talk a little more about this. Let's go live to Birmingham and talk to Dr. James Brown, who's an expert who's researching into obesity and diabetes at Aston University. James, thanks very much for coming in.
Hi, Huw.
This sugar, I was about to say emphasis, some people call it an obsession. Which side of that argument are you on?
I think sugar obviously plays a role in obesity. If you look over the last 40 years, we've seen increases worldwide in sugar consumption, which have happened at the same time as increases in obesity. But the key thing is it's part of the problem. It's not the sole factor. And what worries me is this obsession with focusing on single factors as being the cause for obesity. We did that with dietary fat for so many years, and that was disastrous. And I think it's important that we see that sugar consumption is an important factor in terms of risk of obesity, but there are so many other things that are also important.
OK, well, if it's not the sole factor, what would you say if somebody said, well, it's the biggest factor? It's one of many, obviously, but it's the biggest factor of several.
I would disagree. I think the biggest factor is a lack of understanding of how many calories we actually consume. A piece of research was released last year which showed that the average Briton underestimates their calorie intake by about 1,000 calories a day, which is a huge amount. People are unaware of what correct portion size is. People are unaware of every meal that they eat, how many calories they're consuming. And I personally think that's a bigger issue than sugar per se.
So are we back to the argument about what is a balanced diet?
I think that's part of the argument. There is a growing consensus that we need to consume a more Mediterranean-style diet, and that means changing some of the major food groups that we eat. And it's about things being in moderation. My worry, as I said earlier, is that if we just focus on sugar, these guidelines are welcome, please don't get me wrong, but they are guidelines, remember, it's not legislation. So whether this is going to have an impact in the long-term health of our children and adults who are at risk of obesity and all those conditions obesity causes an increase in the risk of, we'll have to wait and see.
I was just about to say, James, that the difficulty for the public, I suppose, is that you get used to one message, which is a message that is hammered home. In one case, it's fat, and then it's sugar, and you can't blame people then for being slightly confused as to what the right course is.
No, I completely agree, and this is where scientists and doctors and policymakers have really failed the public over the last 30 to 40 years. The message we need to get across is actually quite simple. It's eat less, move more. And if we regulate our dietary intake, if we introduce long-term behaviour change and make sure we're more physically active, that's going to be a way we can prevent this crisis from becoming even worse.
Physically active. What about other measures in terms of when you look at localities, when you look at the availability of, let's say, junk food and all the rest of it? I mean, how proactive can government be in that area?
Well, government, both central and local, can play a role in this. Councils have the ability to control the number of takeaways in a town centre. They can control whether or not certain shops can open in and around schools. And I think it's that type of approach that needs to be taken alongside guidelines for the amount of sugar that we consume, guidelines for physical activity, limiting advertising of products directly to children or at times when children can be watching television. And we need this multifaceted approach to try and solve this problem.
Dr. James Brown, good to talk to you, and thanks for coming in.
Thank you.